I had a patient who once tried to kill me by running me over when I used to ride my bike at like 6 in the morning to the hospital.
What are the stories and life advice of the psychiatrist?
Yeah. I mean, how many hours do you have for me to recount the most traumatic experience of my life when, my wife was having a healthy pregnancy and, everything was okay, and that baby stopped coming out, and instead of going down, it went up. We went from, wondering if the bris was going to be on Yom Rishon or on Yom Sheni to wondering, if anybody's going to make it out alive. Most importantly, the OBGYN physician who I was planning on killing at that point in my life for botching the delivery.
Howdy, it's Ari Fingerer. Welcome back to another episode of Jewish and Joyful. To have a different type of episode for you, something very interesting, something a little different. For this week's episode, a few months ago, I sat down with a psychiatrist. Now, don't worry. It wasn't for a consultation or meeting. It was for this interview. I like making that joke. He has such an interesting life. He grew up in Boston. He went to show, decided to become a doctor, psychiatrist. He deals with some crazy cases, some very interesting people. And you're going to hear more about his patients, his life, the work he does, and how he got into the soul. He's also going to share some personal stories about himself and some very, very wild stories he had personally. Make sure to stick around to hear the whole episode. This episode is full of interesting stories, mental health, Q&As, and so much more that could hopefully give us a lot of inspiration. If you're not subscribed yet, please subscribe so you can only put out more stuff. If you're watching on Spotify or Apple, please rate us 5 stars. Please comment and share with friends and family if you enjoy it. We have some more incredible stuff coming out, some crazy stories of people hopefully coming out in the future, so be sure to stick around. Later in this episode, you can hear about the weekly Parsha inspiration and Ohr Olam Mishnah Berurah. Enjoy this special episode with the psychiatrist. You're going to hear what goes on behind closed doors. Welcome, Dr. Freedman. It's so great to have you here.
Rabbi, it's an honor to be here with you.
To get started, can you take us back to your childhood? Tell us what your background was like.
Yeah, I'm from Boston. Baruch Hashem, it's a great out-of-town small community. It's a pretty famous city by professional sports. By Yiddishkeit, it's famous for the Boston Rebbe's at Sal. And my first memory growing up was baking matzahs with him. He was a big tzaddik. After that, I completed my training at Harvard Med School, which used to be something that I was proud of before it became what it is nowadays. Yeah. And I was zocheh to have a very special relationship with the Rosh Kollel in Boston, Rabbi Naftali Beer. It was zocheh to daven by Rabbi Maui and to know the Boston Rebbe's at Sal. And It was definitely a great place and exactly where I needed to be at the time. And now I'm here in Yerushalayim, which is pretty fantastic. I'm wondering if I'm your first guest that is doing a show out of a bomb shelter. Am I?
No.
I'm in a bomb shelter right now. Thick walls. You gotta work hard to explode me these days.
Are there sirens on right now, or this is just your hub, your place?
The main siren that I have right now is reminding myself not to be too funny on a public platform. But I'm here.
So you'll tell me it all after. So what do you do now? What does your schedule look like on an average day?
Great question. I wake up very, very early. I try to daven as early as I can before people start bothering me. To do different things, whether that's my family, my patients, or other wonderful folk. I try and exercise. I try and do mindfulness. I race as fast as I can to my office. I see a patient or two as a psychiatrist, and then I go to my chabrisa in the old city. Right now we're learning Sukkos. It's very, very meaningful. And then I go back to my office, I see patients, and then I do rogue public health work, meaning anybody who calls me and wants me to give a talk somewhere, I'm happy to talk about mental health, about mental illness, about substance use, about healthy coping skills, about unhealthy coping skills. It was actually pretty hilarious. I once got a phone call from a prominent Rosh Yeshiva here in Yerushalayim that he had a patient who was struggling with panic attacks, and the poor guy was just having an awful time. He asked me if I'd run on over to my office, and so I figured as opposed to walking from the old city through the shuk to my office, where it is now, that I would take a cab to get there on time to see this fellow in order to make sure I had enough time to do a proper evaluation. So as I'm getting into a cab, a bacher runs and jumps in front of me and steals the cab and says, sorry, I have an appointment. I had an appointment too, but I didn't take it personally because, you can choose to get mad about that stuff, or you can just say that everybody's off to do some kind of a mitzvah and try and be down the chaschus. And I ended up catching a cab a few moments later, got to my office, and lo and behold, my new patient had just jacked my cab, which is, not particularly the way he was planning on starting our appointment. But I've also had patients come to my office and, take my sandwich out of the fridge and just start eating it. I had a patient who once tried to kill me by running me over when I used to ride my bike at like 6 a.m. to the hospital. I had a patient who literally, I recognized him. I said, Mr. Goldberg, that's not his real name, obviously. I said, Mr. Goldberg, you got to be careful about guys riding a bike. They might be out there trying to save your life later in the day. So sometimes we have interesting experiences, and, it reminds us also that, the person sitting next to you might be a person that you want to be nice to, because you never know how it's going to sort out later. The person on the bus next to you might be the chavrusa of your future brother-in-law who's going to ask questions. Did you ever meet this kid? You ever see him? Is he a nice guy, or does he just smoke chewel and e-cigarettes all day long and text on his phone?
What inspired you to become a psychiatrist, especially one in Israel, in Eretz Yisrael?
So, medicine is such an amazing profession, and there's so many things that you can do within medicine. But I'm too tall to be a surgeon. I'm too short to be a professional basketball player, but I'm too tall to be a surgeon, because all of training and surgery, you're bending over and holding open somebody's abdomen. So that used to hurt my back tremendously. Couldn't do that. I really liked pediatrics. I thought pediatrics was very meaningful. Loved hanging out with kids, being samech them. You get to make all sorts of funny faces and hang out with kids during your training in med school. But I found that it gets a bit monotonous doing outpatient medicine. So family medicine and pediatrics were kind of out. I was good at reading EKGs, but I kind of felt like cardiology was a bit like plumbing. There were just way too many expected things that you had to do, and then it's done. You couldn't be too creative. So that got a bit boring. I thought about doing OBGYN. I love delivering babies. That was, again, incredibly meaningful. Doing C-sections is like the most special thing. Reproductive endocrinology, which is IVF and ICSI, and, helping people to have babies is just so, so special. And we know that Mashiach doesn't come unless all the neshamas get out of the goof. So anybody who's doing IVF for a profession is really helping that process along. But the hours were quite difficult. In order to be the kind of OB that I would have wanted to have been, 24/7 call was going to be a bit difficult. And I had great mentorship in psychiatry. When I did my rotation as a med student, there were two folks, both men in their late 40s, who were dads, and they had good senses of humor, and they talked about their cases in very meaningful ways. And they used to say, where else can you learn everything about your patient? In gastroenterology, you can learn everything about a patient's small intestine, large intestine, esophagus, stomach, and then you're running out of things to know about them. In cardiology, you can know all about their veins and their arteries and their heart itself, but then you're running out of organs. In psychiatry, we can know everything about our patients. We can know their favorite podcast that you've run, Rav Aryeh. And that's part of the treatment, and that's part of the diagnostic experience. So it's very special to mamish get into somebody's kishkas even deeper than the surgeons do when they're removing somebody's small bowel. So that's very special, and it's never boring. And I think also psychiatry lends itself to so many different things. So many of my colleagues are involved in public health, going around encouraging community to be wiser and more loving and caring. I think in psychiatry we also have a lot of overlap between the legal system and the medical system. In psychiatry, we have so much overlap also between halacha and the way that the body and the mind work. So it really lends itself to an amazing and quite a broad experience with what one can do over the course of their day, their week, and their career. So obviously I like it.
So we got some questions sent in. What would you say is the percentage of genetic predisposition and people who are just not fulfilled in their lives?
I think I'm going to break up that question into a few different spots. We know that 1% of people will develop schizophrenia. About 2.5 to 3% of people will develop bipolar disorder. About 1 in 40 will develop OCD. About 1 in 10 women will have postpartum depression. About 11.2% is the best number I ever saw for developing a medical addiction. So we know that there's a strong genetic basis, and then there's also environmental triggers. So somebody who has the genes for schizophrenia that starts to smoke marijuana or do hallucinogenic drugs is at a significantly higher risk of having both the onset of the disease as well as the severity of the disease being, frankly, a life-altering experience for them. We know that people who are predisposed to depression, who have drinking problems and drink a lot of alcohol, are much more likely to develop a more severe treatment-resistant depression. In the same sense, we know that folks who are at risk for anxiety disorders that are sober, that exercise every day, that get enough sleep, that take care of their body, can prevent the onset of illness and then can actually treat their condition through behavioral modifications and lifestyle choices. So what percentage of people are going to have challenges with mental illness and addiction? It's pretty high. I would imagine it's somewhere around 1 in 3 is a good number. That's the number of folks who at some point will have some sort of a medical intervention for their symptoms. But there are many people who are at risk that will choose to really live happy and healthy lives to avoid challenges with mental illness and substance use. And then there are people who have struggles with mental health issues who will also make courageous decisions to live happier and healthier lives. So will a lot of people struggle? Yeah. Will people who don't have mental illness also struggle? Absolutely. There are plenty of people who are dealing with mental illness that live very, very meaningful lives. Aaron Beck, who is the founder of cognitive behavioral therapy, talked about his own challenges with anxiety. Martin Seligman, who is the founder of positive psychology movement, talks about his own challenges with depressed mood. In the same sense, there are plenty of people who don't have depression, anxiety, bipolar disorder, or substance use, and they're just not the nicest folk. You don't want to marry them. You definitely don't want to sit near them in shul, and you don't want to go into business with them. That's not because they have a mental health problem. It's because they have an achrayus problem, perhaps, or a challenging temperament. So I think all of us, though, can strive to live healthier lives. Both with our minds and our bodies. And all of us can strive to live more meaningful lives.
So how do we live more meaningful lives?
Great question. How do we live more meaningful lives? How do we live healthier lives? So, Rabbi Twersky wrote a Perush on Mesilas Yesharim. I think it's probably one of his best, for sure. And one of the things that he says in the introduction is that I'm going to use a lot of examples from my work in dealing with people who have addiction. And he says the reason is because people with addiction deal with many of the same things that people who don't have addiction deal with. And many of the things that are helpful for people who are recovering from addiction are also helpful for people that don't have addiction. So, in general, everybody needs to get enough sleep. Everybody needs to get enough cardiovascular exercise. Everybody would benefit from keeping a journal, doing mindfulness exercises. Everyone would benefit from more sobriety. Everyone would benefit from more meaningful social interactions. We know that patients who are dealing with depression that don't have close relationships are at a significantly greater risk of hospitalization, suicide, heaven forbid. In the same sense, though, when we look at people who are in the later stages of their lives, in their 50s, 60s, and 70s, some of the studies by George Valiant and Bob Waldinger from the Harvard Human Development Study show that high cholesterol is not as dangerous for a man over the age of 60 as not having a good relationship with his wife. That high blood pressure is more likely to kill you than not having high blood pressure, but it's not as dangerous as not having meaningful interpersonal relationships. So human connection and loving relationships where, the currency is time and giving, as opposed to just receiving and personally benefiting off of different connections in a more materialistic fashion. These are helpful things that can help all of us to live our best lives.
This is a broad question, but what would you say is the biggest challenge, the biggest struggle facing the community at large or the world at large today?
Acharayas, I think that the idea that gimme, 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 McGeely, I deserve this, is a very big problem. I'll never forget about when Dr. Ben Carson spoke at my graduation from med school, and he said that the person he was proudest of was his mother, because she worked 3 jobs in order to support their family as a single mother, and that was what gave him the drive to become the world's greatest neurosurgeon. Acharayas. I think that a lot of times I work with patients who tell me they don't want to wake up for davening in the morning, and so they sleep until 12 p.m. I say to them, I don't care if you daven, that's between you and God, but you got to wake up every morning, by 8 a.m. in order to be a functional member of society. Whether or not a young man wants to be in yeshiva or a kollel, he's still got to wake up and do something productive during his day. So I think that, again, derech eretz and Torah go together. When people aren't responsible, functional adults, their Torah learning is going to be non-existent and fizzle away anyways. When people are learning the Torah, but they're not learning midos and responsibility, we have to ask, were they really learning to begin with? In America, if I understand correctly, approximately 50% of people are receiving social welfare. And, thank God, it's wonderful that people can receive benefits when they need them. But there are plenty of people who get a check every month, and that's, a death sentence for them, because it keeps them from going out and having meaningful employment. Again, I have so many patients who come to my office and they're on disability and receiving monthly checks from the government. And I tell them, well, you still got to go do something. And they say, well, if I go to work, I'm going to lose my monthly benefits. And I'll say, well, you got to go volunteer then. You got to get up and go do something, because being stuck in one's house and being stuck without any meaningful daily structure is terrible poison. Don't forget, in the Chinese reprogramming camps and in the gulags, they used to just have people repetitively paint the walls. That's what Pitom and Ramses was all about, building structures that collapsed, the next day and having to go build them again. That's psychological torture. We have to give people meaningful stuff to do. And that's a big challenge and big struggle for many people in our community who feel disconnected from their learning, but feel like they need to remain within the system, is giving them a viable path to being a mechubadig person in our community, whether or not their primary position is in learning. So, acharayas, having something productive to do with our day is good for mental health. Those are kind of, again, the foundations of a healthy life. Not trying to pull people out of yeshiva by any means. I just want to be clear. Not trying to pull people out of learning. It's just for many people that feel stuck there, it can be quite a difficult thing, because getting up and doing something is very, very important. And there's so many Haliga people like Eli Beer who didn't make it in yeshiva, but made it saving tens of thousands of lives for Baruch Hashem. So having productive things to do and taking the achrayus, having the personal responsibility to get out and do things is critical.
Get back to some of my favorite parts of this episode. I want to talk to you about the Parsha inspiration that's changing so many people's lives. We all want something nice in the Parsha. We all want uplifting thoughts, something that will really make us feel great and inspire us. Parsha Knowledge provides just that. Parsha Knowledge provides weekly inspiration on the Parsha, a beautiful takeaway every single week with a beautiful Vardan story. And you could join for free by emailing info@parshaknowledge.com, visiting the site parshaknowledge.com, or you can WhatsApp 646-397-2320. What would you say is the Torah influence on dealing and treating anxiety, depression, abuse, drug addiction, alcohol addiction?
Great question. So I do believe that many of the foundations of Chazal have provided us with the basis for evidence-based psychotherapy treatments, such as cognitive behavioral therapy. We all have bubbies who told us, "Frach good, v'zayin good." If you think good, then good things will happen. That's positive psychology. That's the placebo effect. If we believe that things are going to work out, they're more likely to work out. So, in the same sense, we know that Chazal would prepare for an hour before tefillah. They daven then for an hour. We learn this in brachos, and then they spend an hour coming down, and that basically describes mindfulness practice. And again, doing breathing exercises and thinking about what I stand for and what my goals are and how I can achieve them and being present in my life. This decreases blood pressure. This improves cerebrovascular blood flow. It allows us to be more effective human beings. So I believe that many of the things that the Torah teaches are some of our best psychotherapies. The Torah tells you can't go out and just be a drunk. It's usher to be a shikr. Even those who say, well, one day a year you're supposed to get wasted. It depends which posek you hold by and which rishon you're reading into. I would say that you're not supposed to go get drunk on Purim. There are other things you can do to be joyous. But the Torah is very clear, recreational substance use is not appropriate. Gambling is not acceptable. You can't be an aid if you're a gambler. So the Torah tells us we have to have good midos. I think the Torah also tells us that we have to have, respectful long-term relationships with our spouses and our family members. And even if a person has difficult family members and challenges with their spouses, the Torah gives us rules for keeping our relationships productive and healthy. And this is also part of being in a community. It used to be in the Alterheim, in the old country, that if you didn't show up to davening for 3 days, they would come knocking at your door because they thought you were dead. The power of community. Ephraim Millah, where were you? Where are you? We love you. We miss you. Levi, where you been? Come out, spend time with us. So I think that the Torah respects this. I think the Torah also respects the importance of caring for people that are struggling. There's a very high emphasis placed on what we would call vocational rehab. People that can't work in our community are given jobs. You have to teach a man to fish, which means that the fisherman who does a good job with his parnasa has to take along the guy who's struggling and to give him something meaningful to do with his day. I think, our community tells us you can't have Shabbos, Chazal say, you can't have Shabbos, you can't have Yontif unless you invite the Aniyim, unless you invite the Somim, the Almanas. You have to invite people who are struggling, who are potentially depressed, who certainly are at risk of being depressed and anxious and struggling. And you have to give them a place at your table. My wife is a social worker, and she and I from day one have always had folks who have their challenges at our table. Our Shabbos table has always been filled with folks who live at the shul. And, as a young man, one of my formative experiences was having my uncle, Lev Shalom, living with us, because At that point, he could no longer live with his family. I actually wrote a kid's book about it. It's about having Uncle Baruch living in the attic because he couldn't live with his family anymore. And, it wasn't Shabbos without it. It wasn't our family without him. So our community does a great job of keeping people out of institutions, and within the community and feeling like mechubadik people in the community. So that's a very special thing, that I believe a Torah lifestyle and in general, the Frum Belt does.
I want to share with you on something you said, a word I heard from my father. It says in Parsha Bahar that if you're in close proximity with your brother and he becomes impoverished, you should strengthen him, you should support him. So there's an obvious question here. The question is, in the Midbar, everyone had whatever they needed. Everyone had support, right? Everyone had man for food. They had the wells for water. They had clothing. So what type of support will one need? How would someone be able to help someone? So the Avnei Nezer says something incredible. You know what he says? He says that v'chazakta means literally to strengthen him, to give him chizuk, to make him feel better, because we can have everything we need. So many people have affluence but suffer from affluenza. All some people need is a pat on the back. They need some love. They need a warm hug, a warm smile.
Pat on the back. We love you. You're part of our community.
Yeah.
We love you. You're part of our community. And if there's anything that we can do to help you out, we'd love to. I think that we have to remember that everybody who goes out there and, heaven forbid, ends up hurting themselves or Rahmanis commits suicide, there was the last person that they talked to and the last person that they called. And when we keep in mind that we know who's struggling and we know who's definitely at risk, once we're sensitive, thoughtful people, that we should try and make those moments count. And we should try and be loving and supportive of the people we talk to, but we should also make the extra effort to invite our friends out who we know are struggling and who we know haven't been out too much. We should also make the extra effort to, pick the guy who nobody wants to learn with as a chabrusa because he's kind of weird and he comes from a dysfunctional family. That's the guy we should dafka go to learn with, because that's the guy who's going to drop out and feel bad about it and turn to alcohol and drugs. That's the guy who's at most at risk. The guy who nobody wants to pick in the basketball game, sits on the side of the court and then eventually walks home. That's the guy who becomes depressed. That's the guy we got to pick. We're not there to win pickup games. And, when you're a 18-year-old kid, it doesn't matter how much Baba Kama you know, your mitzvahs come from being nice to that other 18-year-old kid who's going to drop out of yeshiva and be an at-risk into very struggling human being. So we gotta love each other. We gotta give chizuk to each other in this midbar generation that we're living in, Rav Aryeh.
Thank you. I want to ask you, I want to veer off a little about stress. I want to ask you, what was the most stressful time of your career and how did you overcome
it? I used to work like 110 hours a week as an intern. I remember actually leaving the hospital after working a 36-hour shift and going on the wrong train and not even realizing that I was on the wrong train until I had just gotten off in some Verworfen place in the middle of nowhere. And then I remember getting back on the train and forgetting that I was no longer working and just going back to the hospital. Those were dark times. Yeah. I remember, the times that I sometimes got to see my wife and kids were when they would come to the hospital lobby and they would wait in the hospital lobby and I would say, I'll be there in 14 minutes. And then I would get a call that there was an emergency and I would say, I'm sorry that you slept in here. I can't come down. I don't want you to wait here for an hour until this is done. Those were very lonely times. How did I get through them? I think you have to keep in mind what you eventually want. And when you can keep in mind and have a good crystallized picture of where you're going, then it's easier to connect the dots between where I am today and where I'm going.
More incredible parts of this episode coming. I just want to tell you about Ohr Olam Mishnah Berurah, the revolutionary Mishnah Berurah that's enhancing so many people's ways of learning Mishnah Berurah. If you never learned halacha yet, now's the time to start. Ohr Olam Mishnah Berurah makes it so easy. It's Hebrew-English Mishnah Berurah, Hebrew once and English another. You also have some beautiful pictures and diagrams and Q&As in the back, so it's perfect. You go in a local bookstore, you can also click on the link in the show notes. Get the Ohr Olam Mishnah Berurah. It will change your way of learning Mishnah Berurah.
I had incredible mentorship during my training, and one of my best supervisors, professors, he said to me in the beginning of my second year, what's your dream? And, I kind of gave a stock answer about, I want to be a good doctor and helpful, because I felt like he was, still kind of evaluating me. He said, no, come on, you're a frum guy. He was a frum guy. He said, what's your dream actually? Like, what are you going to do? And I was like, really, Dr. Curtis, you actually want to know? I said, yeah. He said, I want to move out to the hills somewhere outside of Yerushalayim, and I want to study scripture in the morning and have a few goats and, go into my office and help my people, because there aren't too many doctors with big beards like me that, folks in my community will trust. And so I want to be a really, really good doctor and work really hard for the next few years of my training, so that way I can get out there and do it. And he looked at me and kind of leaned in and said, I own a few goats. Now, I haven't had goats in a while. I had them during Corona because, you could walk out to go graze your animals. Otherwise, they'd give you like a 500 shekel fine. So I got a few goats and just kind of like kept them in my driveway, and me and my kids would like walk around with them. It was pretty fun. It was definitely a bizarre experience. And a lot of my neighbors were like, why does Freedman have a goat? And I was like, I don't know, so I can walk around outside. Why are you just watching me and my goats from your windows? That's a lot weirder than me having a goat. But, if you have those kind of experiences, laughter is the best medicine. I try and laugh a lot. I try and, smile. I try and hear good stories. Laughter is the best medicine unless you have diabetes, in which case insulin is the best medicine. But aside from that, we got to laugh. We got to have an appreciation for the fact that Hashem has a plan, whether or not we see it in front of us. And, we know that positivity is something we have to strive for. Yeah. So those darkest times in my career, certainly was just the amount of work. It was intense, and I would see 50 patients a day, and just, darkness. Sometimes, not walking outside of the hospital for 34 hours in a row, 36 hours in a row. It was really a bizarre experience. It's like being trapped in a casino, except instead of winning money, just people are screaming at you and throwing things at you.
I was wondering, it's a lot of hours for someone to do at one period of time. Is it safe? Do they still do it?
Now you are not. Now a lot of the rules are closer to 24-hour shifts, but those were not the rules during my training. The rules during my training was go to work, and when we tell you can leave, you'll leave.
How do you do it? How do you work for so many hours at one time?
Tengo brazos fuertes. You get pretty strong out there, and you get mentally tough, and you also are quite delirious, and things start to get more ridiculous with time. But it's a very holy undertaking. Also, getting out there and knowing that you can help patients to live happier and healthier lives. And, certainly those shifts were spent covering the inpatient unit, where there's a lot of very sick patients who need a doctor, and you don't really have a choice because they're sick and you're the doc. Now, in the same sense, that's also how you learn a lot. There was a time in my career when I still had hair on my head and my beard didn't have any gray in it. Now I've probably seen close to 15,000 patients, which is not as much as Dr. Salzman's 40,000 patients that he told us he saw, in the twilight of his career, but it's a bunch. And, the fact that I've seen so many patients allows me to have a better understanding of what's going on with the patients I see today in my office and how I can be most helpful to them and their families. So there's nothing like experience. I mean, you don't want a moil who's new to the job.
In your book, you mentioned a very, very powerful story of a very hard time you had in your life with your wife and your child. Can you share with us that story?
Yeah. How many hours do you have for me to recount the most traumatic experience of my life when, my wife was having a healthy pregnancy and, everything was okay, and that baby stopped coming out, and instead of going down, it went up. Or I should say him, baby Yehuda. So that was tough because we went from, wondering if the bris was going to be on Yom Rishon or on Yom Sheni to wondering, if anybody's going to make it out alive. Most importantly, the OBGYN physician who I was planning on killing at that point in my life for botching the delivery. And I remember the specific moment you're recalling is when my wife was in the ICU getting transfused because she'd lost a lot of blood, and the baby was in the NICU, and they were asking, do you want to do everything you can to save this baby's life? And again, 15 minutes previously, we were wondering, is it going to be a Sunday bris or a Monday bris? Because Sunday brises are obviously better in America because more people can come, which is, of course, a problem if you're trying to afford catering at an early part of your career. But, so I'm sitting there listening to this guy tell me, do you want to do everything you can to save this baby's life? And I'm like, yeah, obviously. And he says, well, it might not be so easy because he's not going to be normal. And I said, what does that mean? He says, probably never walk and talk if he makes it. And I said, what are we talking about here? My brain is still in a million different places, wondering about a Sunday versus a Monday bris. And are we going to have meaty catering or milky catering? And the guy says, are you listening to me? And I said, I'm listening. So what percentage chance is it that this kid's going to make it? And he said, I felt like Avram Avinu because I'm asking, is it a 50% chance? Is it a 40% chance? Is it a 30% chance? A 10% chance? And he says, this is 0% chance. This is going to work out well. And I must have scared him the way that I was looking at him too, because they called the security guards, who were all my friends because I had trained in the hospital. We were buddies. I used to buy the security guards coffee and donuts because you always want them to be your friends, especially when you're on the psych unit. You will want them to come running to protect you, house for shalom, if you need it. So I always bought them coffee, and they came up and, hey, doc, what's going on? Are you cool? And I said, yeah. And I looked at the guy and I said, it's great that there's a 0% chance that you're saying everything's going to be okay, because, if you told me there's a 5% chance, I'd have to say, I hope you're a really good doctor. But if there's a 0% chance, then that means it's between me and the Kadosh Baruch Hu. And, Hashem is the real doctor. And it was a lot easier at that point to just give myself over to a Kadosh Baruch Hu and say, I'm done with docs, okay, Hashem, do what you got to do. And, I'm here to accept your gezerah, whatever it might be, l'tov or l'ra. And Baruch Hashem, everybody's doing good. Really, Canaan Hara, Yehuda's big kid now, can beat me up already. And his mom is healthy and was able to have more kids afterwards. Baruch Hashem, big nisim and niflaos.
Man.
So there was a nurse who was there. And apparently she heard me say, that I'm glad it's a 0% chance because I don't have to trust in doctors. I have to trust in God. And she came up after me, maybe a week later when my son was still in the NICU. I used to go in and dance with the janitor every day that he was still alive. The janitor was some very sweet Jamaican fellow. And everybody wondered, why is this guy who looks like, Mr. Clean, hasn't shaved in 40 years, dancing with the janitor in the neonatal intensive care unit. But she found me, one day and she goes, Dr. Freedman, I just want to tell you, I was there when your kid was born and they brought him into the NICU and, I heard what you said and I have Crohn's disease. And I told my doctor when he said, they're going to have to surgically remove my entire intestine. I told him, I believe in the God of the Jewish people and I don't believe in doctors.
Wow.
And he said, Nurse O'Leary, what does that even mean? Have you lost your mind? And she said, no, but I met somebody who seems to have found his. It was a very big reminder of what I always feel in my clinic as well, that, I can try my best, but I've seen plenty of times where I thought I knew what was going on and I didn't, or this treatment's supposed to work, but it doesn't. And it's a very humbling experience to be reminded that, we're just shaluchim. It's also a reminder that there's a lot of good work that we can do to inspire the people around us. As I said before, you never know whose cab you're stealing. You never know who you're sitting next to at the bus. You never know who you're cutting in front of at the post office. Like, we have to live lives of menschlichkeit. We have to be responsible, loving people to not only the ones that we know, to our neighbors and our family members. others, but we have to be loving and caring and respectful of people that we don't know. Because we got Rev Aryeh. Tell me something else good. Tell me something else good. What do you want to know? You want to know why I'm here in Eretz Yisrael in a bomb shelter right now? Listen, it's the Pia Zetzner's yahrzeit.
Yeah.
And the holy Pia Zetzner, the Eish Kodesh, Hashem Yikom Da'o, he had a brother who's less famous in some circles, who was the Admor Chalutz, Rav Shayla Shapiro Zitzal, was his brother, and he was also on track to be an Admor in the Alterheim, but he had a bug to come to Eretz Yisrael. And in one of the famous letters between him and his brother, the Eish Kodesh says, come back, be an Admor, we need you. And he said, I'd rather be a garbage man in Eretz Yisrael than an Admor in Chutz La'aretz.
Wow.
Which is a very interesting thing to say. But, I have this funny jacket on that has these fancy logos from Harvard Med School. And there was a time when I could have had a professorship there and, been a Hashava Mechubidig doctor there, and instead, I walk around in Eretz Yisrael and I get paid in kugels and svarim sometimes, and those are the most delicious kugels and the most meaningful svarim I get to learn. So I wouldn't trade it for anything.
What's the best way to be joyful now with all the hard times going on?
Perspective is very important. In cognitive behavioral therapy, we talk about the triad of the cognitive triad of depression, which is whereby a person who's failed a math test, who might be depressed, would say that I failed this math test because I'm an idiot, as opposed to saying I failed this math test because it's hard. A person who fails this math test will say I failed this test and I'm going to fail also my Limudei Kodesh tests, and I'm going to fail my driver's test. I'm going to fail every test there is. Whereas a person who's not depressed would say, I failed this test, but I'm doing good in my Gemara learning, and I, have a nice internship set up. A person who's depressed would say, I failed this math test, and I'm going to fail every other math test until the end of time. Whereas a person who's not depressed would say, I failed this math test, but I'll get them next time. So we need to take off our dark sunglasses and have a bit of perspective that sometimes there are hard tests out there. And that's okay. And sometimes there are areas of our life that we're not going to be successful in, but there are other areas that we will be. And sometimes today is not your day. This week is not your week. And sometimes it even feels like this Gilgul might not be my Gilgul. But, there's sunshine around the corner. Chagi baboker estecha v'anascha ba'leilos. I think having mentorship is very important. Having a rabbi, having an uncle, having a neighbor, having somebody in your shul who's a generation ahead of you, even 5-10 years ahead of you, that can, remind you, listen, I went through this too and I figured it out. You're not the only one. On Pesach in my house, our family has always sung songs in Hebrew, English, but also Yiddish and Ladino and Arabic, because we're not the only ones who have had difficult times. It's not just our story, the Freedmans. It's the story of Klal Yisrael over the generations, and remembering, V'hishe Anda, that there's a lot of sorrows out there, but this is not our first rodeo. And, those guys tried to squash us, the Mitzrayim, the Babylonians, the Persians, the Greeks, the Spanish, and now the Arabs, tough noogies. We're not going anywhere. So a bit of perspective is very important.
Could you offer some inspiration, some chizuk on dealing with struggles, temptations?
Oh man, this is kind of a loaded question. So I'll just remind folks that Yetzer Hara was created by a Kadosh Baruch Hu, and that's okay. Yeah. If you didn't have a Yetzer Hara, you wouldn't be alive. And we know that the greatest tzaddikim have the greatest Yetzer Hara. So we have to remember that tzaddikim fall, but they get back up, which is what makes them tzaddikim. Shevi Yipol Tzaddik V'Kam. So the fact that a person has done things that they're not proud of is actually very special, because when they bounce back and when they do things that they are proud of, it's even more meaningful. I'm not here to give a Torah shiur on, when we do tshuva, do our Zidonos turn into Zahuyos or Shagagos. I'm not here to talk about how the Vilna Gaon says that maybe real tzaddikim will periodically do averas so that way they can have the mitzvah of doing tshuva. That's not what this is about, but rather just a reminder that we're all human beings. Rabbi Twersky Zatzal said that all of the people that he trusted in his life were addicts. Not addicts who were actively using, but addicts who were in recovery. He said, my lawyer is an addict, my accountant is an addict, my dentist is an addict, my car mechanic is an addict, my doctor is an addict. And he said, I trust these people because they've been through hard times and they're very yasher people who've worked on themselves. Beautiful. I once heard from one of Rabbi Twersky's granddaughters, actually, that the babysitters he hired, in some cases, were also recovering addicts because he trusted that they would be very, very Christic people. So I do think that there's tremendous value to realizing that, okay, I have Yetzer Hara. That's because I'm a human being and, I've done things I'm not proud of, but I'm going to bounce back and then I'm going to be much stronger from the experience.
I love the song, When You Fall Down, You Get Back Up. It's such a beautiful song, but how do we live it? How do we bring it to our lives? How do we realize that even if we fall, we have to get back up?
Correct. So I think perspective is important. I encourage a lot of my patients to write one positive thing that they've done every day. If you write down one positive thing that you've done every day, by the end of the month, you have 30 positive things that you've done. By the end of the year, you have couple hundred. By the end of a decade, you have notebooks saved up of all the good things that I've done. And it's easy to reflect and say, I've done some good things in my life that I'm proud of. In my own book, oftentimes I remember when I went to go moonlight and cover an eating disorder hospital because I didn't have any money to give to tzedakah that year because I was in my training. And I felt terrible that I couldn't support the kollel. So I went to go work a 24-hour shift one Thanksgiving. And I, was makdish that money for tzedakah. And I remind myself about that when I feel down sometimes, that was a big mitzvah that you did that. But I think also small things, though, are helpful. The best fortune cookie of Avodah Zarah proverb is that the journey of 1,000 miles begins with a single footstep. There's a reason that we have Nagelwasser when we wake up, because it doesn't matter what you did last night, it's a new day. And it's a new day because, we're reminding ourselves of what the Kohen Gadol did and going in to do the Avodah. It's a new day because we're washing the tumah off of our hands. But just practically, it's very sensory. Waking up in the morning and having cold water on your hands is a great way to just wake yourself okay to brush your teeth afterwards. A bit of mint toothpaste will really wake you up too. So sometimes small things can be very powerful. Again, there's a lot of inappropriate things that are out there, and we can't always torture ourselves over the things that we've done, the things that we've looked at. What we can do is try and do better next time. Yeah. But we have to understand that we are human beings and we are not tzaddikim from the times of the Zohar. I heard a great thing from a guy who learned at Esha Torah a very long time ago. And he said that once Rav Noach Weinberg Zatzal told him that the first look is free. First look is free. We're all human beings. So don't beat yourself up about the first look. Second look is a different story. But we're human beings. We shouldn't have unrealistic expectations of ourselves because that's what it means to be a human being.
What was the most profound life lesson that you've ever learned from a patient?
That's a really good question. And I'm trying to think of which answer I want to give because every day I learn so much from my patients. I learn about resilience. I learn about the power of perseverance. I learn about the kind of parent and spouse that I am capable of being. I learn about the kind of parent and spouse I don't want to be sometimes. Yeah. And I learn about what it means to keep on trying because there are patients that I meet who have been to thousands of doctors, not literally thousands, but sometimes hundreds of doctors. And they're, flying from Manchester or from Belgium or from Schweiz or Toronto, Panama, because they want to see one more doctor and get another opinion. And I learned that hope springs eternal. And, sometimes when I meet people who fly halfway across the world to come for a consultation, I learned that they believe that things can get better no matter how dark things are. And that is a very powerful lesson.
Beautiful.
I also hear some of the best drushes ever from my patients. So here's a good one. Tov Shebarofim L'Gehenna. Here's Rav Meir Parmashlaner's Peru Shabbos. He says that the best doctors are sometimes inadvertently mean to their patients. Not because they want to be mean, but because they tell their patients things that they have to do that are hard. And sometimes that bothers patients. And they say, my doctor's so mean to me. He's telling me to do things that I can't possibly do. And so the patient feels that they have a not nice doctor. And in that moment, the best doctors are bringing their patients into Gehenna. But obviously the goal is to schlep them out. So sometimes that's a nice one, is to hear a good shtickle wort from my patients. I also learned how to speak Hebrew from my patients. When I came to this country, I didn't speak any Hebrew, and I didn't have time to do. So I remember sitting in the hospital and bribing a nurse with cigarettes and coffee to go ahead and translate for me. So I not cigarettes that I smoked, cigarettes she made me buy for her. I tried to just buy her coffee in Danish. She said only cigarettes and coffee. I said fine, but I learned how to speak Hebrew, so I felt like it was kind of an even trade.
Who is the happiest person that you know?
Professor Jakobson, Alav Shalom, my chavruso, passed away about 3 years ago, who was a person who achieved his entire potential in this world. He was an incredible doctor. He was an incredible Talmid Chacham. He was Rav Scheinberg Zatzal's favorite Baal Koreh. He was the personal doctor of Rav Elyashiv Zatzal for 30 years. He was Belzer Rebbe's doctor. He used to joke that he's the only doctor alive that will ever give a colonoscopy to 3 Gerer Rebbes. And I remember asking him a few months before he passed away, when he was starting to get older, I said, Reb Zev, what would you do differently? And he said nothing. And he smiled. And he said, are we going to learn or not? You and I have different time schedules, young man. So he was definitely a person who achieved this entire potential. And I think that's what, there's a difference between happiness, which can sometimes be goofy, and, real fulfillment, simcha. Real simcha is, I have a purpose and I'm doing my best to achieve it in this world. So he really worked hard to fulfill his potential. And he was a very happy man as a result of it.
What was the greatest advice they've ever received?
I think remembering that one's children are a meis mitzvah is very important advice. My father, as long as you should live and be well, is a very good doctor. He's the world's expert in non-Hodgkin's lymphoma. He's the real Dr. Freedman. I am not the real Dr. Freedman. I'm kind of a joker. But my dad would come home for family dinner, and then he would put us to sleep and go back to the hospital at nighttime. I don't know how he did it, and I didn't even realize this until I was older. Realizing that your children are a mitzvah. Nobody else is going to be a father to your children. Nobody else is going to teach your kids how to fish. It's going to teach your kids how to catch bullfrogs. It's going to teach your kids how to throw a football. It's going to teach your kids how to hike a mountain. And if somebody else teaches them, it ain't the same as if you do it yourself. So I think that prioritizing time with one's family is something that gets lost in the shuffle. So many guys are traveling for business or doing another fellowship or another internship or another late night deal and meeting, and remembering that being there to raise your kids and being there to spend time with your spouse is very, very important, because in the end, those are the people who have the most impact on your life and on your health as people get into their 50s, 60s, 70s. Having meaningful relationships with one's family is what keeps people alive.
Do you have a final message of hope you'd like to share with our listeners?
I'm Yisrael Chai. I'm giving this shir from a bomb shelter right now, but if you're planning on bombing me, you should be a lot more worried about me than I am with you. We're going nowhere. Klal Yisrael is so strong. And as much as we read this Narishkeit in the news about this group of Jews being upset at that group of Jews and these group of Jews who think that about the other group, we are united. There's so many things that bring us together. There's so many more amazing stories than there are heartbreaking stories of Sinas Chinam. We have so much koach as Am Yisrael right now. And I feel bad for the bad guys, kind of. Not really, but I feel bad for them because we are so strong right now and amazing things are happening. I appreciate you having me on your podcast. I'm going to try and be joyful and joyous and, Jewish and all sorts of other things that you do. Again, it's a big zechus to follow up Reb YY and Reb Shweki. So, hey, if my figure's watching, I hope she's proud of me.
Dr. Freedman, thank you so much for coming on.
Appreciate you. God bless.
I hope you all enjoyed this week's episode with Dr. Jacob Freedman. Hope this gave you more of an understanding of mental health, how to deal with stress, issues, temptations, struggles, challenges, and hope you enjoyed his unbelievable stories. Dr. Freedman just put out an incredible book with Rabbi Akiva Dershowitz. It's called Stories and Halacha from the Psychiatrist Couch. Incredible book. We're going to put the link below, so be sure to check it out. Enjoy this episode. Please rate us 5 stars. Please subscribe. Please comment where you live. Love to know where you guys live. And please share with friends and family. We have some more incredible episodes coming out. Be sure to check out Parsha Knowledge. Get the weekly inspiration to you every week. Email info@parshaknowledge.com or visit parshaknowledge.com. And the incredible Ohr Olam Mishnah Berurah that changed the way so many people are learning Mishnah Berurah. Visit the website, ohrolam.org, bookstore, click on the link below in the show notes. Thank you so much for listening. Have an incredible day.